The rotator cuff can be a common source of pain in the shoulder, especially as we get older. While some of these may respond to non-operative treatment, many do not. And the problem with these tears is that if they're not repaired, they can get bigger. And the tendon can get more stiff, it can atrophy or shrink, and the shoulder can get weaker. The people who do the best with rotator cuff surgery are the people who have the tears fixed early before this happens.
When I first saw Dr. Atkinson, it had just been a few months, and we did an MRI and found I had two small, I think they were 4 mm tears, scheduled the surgery, and I developed a bad sinus infection. I had to cancel it. In the meantime, well-meaning friends talked me out of it, and they said, oh, it'll heal on itself, or heard a couple of horror stories, and I put it off for a year, and then I thought, this is ridiculous. And in that time, 2 of my friends had surgery with Dr. Atkinson. One had a shattered shoulder. It was a year ago. She has full range of motion. She came through it beautifully. She's back doing Zumba. The other friend had a bad tear. Dr. Atkinson had to put anchors in. It hasn't even been a year. He's back on the golf course. He's doing everything he did before. Again, came through it beautifully. Another friend at my church where I do outreach, I had a surgery with him a year ago, came through it beautifully, and she asked me, Betty, are you still having problems with your rotator cuff? I said, I am. She said, what are you doing? Why are you waiting? Get it done. So I did. And my only regret is, why did I wait? I research. I don't just pick a doctor out of the phone book, I research. And if you would Google Dr. Todd Atkinson, you would be very impressed with his credentials. And then again, watching friends. And that's how I went to him initially. But then I watched friends who went to him and how well they came through the surgery. And that just reinforced everything I already knew, that he is the best for shoulder.